Okay. All right. Our project is aimed at increasing Combo 10 immunization rates at the St. Luke's Laurentian Clinic. So the problem at hand here, combination 10 completion rates at the clinic of focus are 10%, which is significantly below the most recent 2019 nationwide average rate of 70%. These low vaccination rates have considerable impacts in a variety of contexts, including people, safety, cost, and quality. The aim of our project is that by the end of August 2024, we will achieve a 30% increase in Combo 10 vaccination rates at the clinic through the implementation of staff education, streamlined pre-scheduling, and the use of presumptive language when discussing vaccinations. Some benefits of achieving this. So, vaccinating children prevents over 4 million deaths worldwide annually. Although some diseases are not common, the germs that cause diseases continue to circulate throughout the world and can easily resurge within communities and infect anyone who is not protected. Poor immunization rates increase the risk of infecting others who may be too young to be vaccinated, cannot receive vaccinations due to immunosuppressive conditions, or have not developed sufficient immune response to vaccinations. Low immunization rates also carry an enormous financial threat. In regards to just measles alone, a 5% decrease in vaccination rates in the US resulted in a threefold increase in annual measles cases and a $2.1 million increase in public sector costs.
The literature provided a lot of insight about the benefits of implementing multiple interventions aimed at improving vaccination rates rather than just one single intervention. The literature that looks at childhood vaccination rates indicates that there are best practices that the Laurentian Clinic is not following, including a combination of the use of standing orders, educating staff on the use of presumptive language, pre-scheduling, and reminder methods, including community outreach. However, given staffing and technology constraints, the project's targeted interventions include pre-scheduling, staff education, and presumptive language alone. A pre-intervention survey will be administered to all 5 medical assistants responsible for carrying out the proposed interventions. Pre-intervention data has been collected, including percentage of Combo 10 completion rates. Post-intervention surveys will be administered and results will be compared to the pre-intervention surveys. These surveys focus on questions such as, I understand the health benefits for our patients and for our community in receiving vaccinations, and participants can respond with strongly agree, neutral, disagree, or strongly disagree as answer options. The number of each individual response to each question and pre and post intervention will be compared using percentages. Post-intervention percentages of Combo 10 rates will also be calculated and compared to pre-intervention rates. Other outcome measures include the percentage of patients and parents that had the option to pre-schedule future vaccine appointments post-intervention, and the percentage of staff that attends an educational session. Some of the balancing measures we're focusing on include average wait time, average appointment time, and percentage of no-show appointments.
Pending IRB approval, the pre-intervention survey will be individually distributed in person to all 5 medical assistants on site. Following the completion of the pre-education survey, the DNP students will visit the clinic to provide one-on-one education to all 5 of the medical assistants. The education sessions will consist of the following: sharing quality improvement goals, discussion on why Combo 10 vaccines are important to children's health and community health, a distribution and walkthrough of a flow sheet to guide decision-making and pre-scheduling, a script reviewing how to address hesitant parents using presumptive language, and distribution and review of a schedule for the Combo 10 series as a reference. 2 to 3 weeks after the education is provided to all medical assistants, the DNP students will revisit the clinic site. At this time, a post-education survey will be completed by all medical assistants. This will also create an opportunity to address any gaps in education the medical assistants may have. The measurements of total vaccines done begins after 5/21/2024 and ends on 8/10/2024. The clinic's pediatric immunization coordinator will provide monthly updates. The DNP students will also reach out to the project champion to discuss challenges on a weekly basis. And this is our reference.